Hello, my name is Teresa. I'm going to be doing a neural and a cranial nerve check on Mr. Michael Brantley. First thing you want to do is note your patient's general appearance. You want to check their personal hygiene, their neatness. I want to say general hygiene, neatness. I guess whether he's been kept about his appearance and everything, and his level of consciousness. He is alert and oriented. Um, he's not asleep. So if he were asleep, or I were testing for to see if he were comatose or anything, I'd be checking his state of consciousness and everything. But at this point, he is alert and oriented. Alert and orient times three. Um, and also doing this, you want to note their speech, the volume, their articulation as they speak. And we'll begin this exam. Ms. Brantley, I'm going to give you 3 words to remember: pen, ball, and cup. I will ask you about these words further in the exam, and I'll just have you recite them for me. We're going to be testing for his memory at that time. To test for his cognition, you can ask 3 simple math questions. Can you tell me the value of 3 plus 7?
10.
The value of 2 times 5?
10.
And the value of 6 plus 4?
10.
Okay. If you were to find a letter on the ground that was stamped and addressed, what would you do with that item?
Is the letter have a mailing and a return, or sending?
Yes, it's stamped and addressed.
Okay, yeah, I will put it in the mail.
Okay. So that tests his judgment to make sure that he's making rational judgment. Also to check for memory, if you had been speaking in the exam for well over, I'll say an hour or so, you can do recollect to have him recite information to you, or that you had spoken about, and have him recite things to you. And that's the memory. So in order to check the cranial nerves, we'll go right into that part of the assessment. Our cranial nerve number 2 is the optic nerve. An easy test you can do is check for visual acuity using the Snellen or the Rosenbaum chart. For all intents and purposes, I do not have that chart available, but he would have to correctly identify the letters on the Snellen chart to me, so that we can check his visual acuity for 20/20 vision or whatever distortion he may have. Also, at that time, if you have a pen light available, using a highlighter for my pen light, but you would check for his pupils for the sensory to light to make sure they are pearl, equally reactive to the light, and you would do a check in going out and do the other eye. You don't have to check. This also checks for the ocular muscle for pupillar constriction. You can also do your 6 cardinal gazes at this time as well to help assess the ocular muscle. Your next one is going to be your corneal reflex, and that one is done by taking a soft object, a Q-tip, and you come close to the eye. You want to have him blink. In that instance, he would blink, and whatever blinks on one eye will blink on the other. They're equal and reactive. And you can also do the trigeminal nerve. This checks for pain. We have like a toothpick here. You can assess that by checking the forehead, applying to the cheek or the chin. We'll check our facial nerves. This stimulates blink. You check for asymmetry when the patient smiles. I'll have him do a smile. I'll have you make puff cheeks. Can you raise your eyebrows for me? Good. Okay. The next check is going to be your vestibular nerve. This is one that you check for hearing. This is my makeshift tuning fork. You would strike the tuning fork and have strike the tuning fork on an object. This checks the hearing acuity for the ear conduction test to see if the air is heard. Excuse me, the air is heard once you strike it and place it on the back of the ear, placing it here, and it's done again, like I said, with the tuning fork, and you do the same on the opposite side. We don't have that test. We could conduct the whisper test, and that's where I would close off one of the patient's ears and whisper a word, and have the patient repeat the word to me.
Red umbrella.
Okay, and then we're going to go to the other side.
Green November.
Okay, and checking this. We check for cranial nerve number 9 and 10. That would be your vagus and your glossopharyngeal. On an alert and conscious patient, we would not elicit a gag reflex on him. But also, why you would do that with the tongue depressor and just have him say and use your tongue depressor to assess it. Cranial nerve 11. I'm going to have place my hand against his face and have him try to push his face against my hand for resistance. And I'll do this on this side. And that's a pass. Okay, I'm going to have you, for the musculoskeletal check also, I want you to squeeze my 2 fingers. Okay, very good. I'm going to push your hands inward. I need you to push outward. Okay. Want to check flexion, that. Okay, bend downward, up. I'm going to push down on your leg, and I want you to raise your leg. Okay, very good. Very good. I'm going to have you push down on my hand. Now pull up. Good. The same here. Here. Alright. And I'm going to try and push your leg. I want you to push against me. Very good. And here. Good. And we'd also do deep tendon reflexes with the hammer, and that's where I would feel here and tap with the hammer on the deep tendon reflexes here and behind the knee here. This concludes my musculoskeletal neural check assessment. Thank you.